a judge has blocked Kentucky's request to add work requirements to the Medicaid program. Now, you'll remember that the federal government approved Kentucky's request first of all of the states that wanted to add work requirements to their Medicaid programs. It was to be instituted by July 1st, should there be no challenges, but there was indeed a challenge. The case of Stewart versus Azar, a class action lawsuit, was brought in front of a judge, and the judge ruled that it was not appropriate to add work requirements to Medicaid. Now, in this instance, many states are watching to see how this plays out because there are 3 other states that already have work requirements approved by the federal government and 7 other states that are waiting for an answer. Wisconsin, where we are, is one of those states. Let's take a quick recap of what happened and then what happened next in Kentucky and then where we go from here. Well, this is something, like we said, it was to be effective July 1st, and in the nick of time, June 29th, the judge ruled no, it is not appropriate to have work requirements in the Medicaid program. And he pointed to the mission statement of Medicaid and how it is appropriate to use Section 1115 demonstration waivers to improve the Medicaid program. He pointed to those as saying they really are designed to improve the state Medicaid program, bring more people to health, and to improve health care generally. And he said work requirements simply didn't align with that mission statement. Kentucky was asking the federal government to approve a waiver that added 80 hours per month to the Medicaid program eligibility requirements, and if you didn't meet that, you would be denied your Medicaid. And work requirements was defined quite broadly, which also makes Kentucky a little distinct from other states like Wisconsin. In Wisconsin, you have to be either working 80 hours per month or engaged in a work training program, and those are your 2 options. In Kentucky, you have a much broader list of options of how to meet that community engagement requirement, and that includes community work experience, volunteering, being a caretaker, and that's in addition to exemptions for things like having a disability status. So the legal challenge, like we said, was the case of Stewart versus Azar. Did the Medicaid proposal advance the program objectives, was the question before the judge, and the judge said no. The Trump administration here failed to meet that standard before they approved Kentucky's plan. So he actually found the federal approval of work requirements in Kentucky wrongful. And like we said, other states are paying attention. There were concerns that were brought up in the Stewart versus Azar summary judgment oral arguments. National Health Law Center, many other groups were involved to try to make sure that the people that were impacted in the state of Kentucky had a voice. And they pointed to the fact that, first of all, the majority of people enrolled in Medicaid are already working. It would be harmful for them to have to prove their work requirements. Many people don't have computers, and a lot of the reporting is an online system. They also pointed to people that would be wrongfully cut from the program and people that need health coverage to get healthy to then enter the workforce, and this was working in the exact inverse of that situation. So what's next for Kentucky? Well, as soon as this decision came down, as you can imagine, there was a little ripple effect. The Kentucky Governor Matt Bevin cut dental and vision care pretty soon, right after this judge's decision was issued. It was seen as retaliatory. It was also seen as a way to cut money from the state Medicaid budget. The governor himself said he hoped mandating work would alleviate a budget shortfall. That's why he wanted work requirements in the first place, because it would cut people off the program and they could therefore save money. His intent was to cut $100,000 and save $2.4 billion. Instead, he cut vision and dental, impacting about 460,000 people in the state of Kentucky. Now, there are additional concerns that, forget Stewart versus Azar, there are additional concerns legally about the way that this vision and dental cut was implemented, whether you could do that without the public notice, like they moved forward with, and with less than 24 hours warning to either patients or providers. As you can imagine, providers are a little confused as well. In the hubbub, the cuts to vision and dental were supposed to be just for adult populations. It is indeed impacting many children, and it should never have done that, so that raises additional concerns as well. We're going to let you read some of this information. In the description, you can click on these links. We share the judge's opinion, Kentucky's approved proposal as the federal government approved it, as the judge said wrongfully, and then some articles that go into a little bit more detail than we have time for here. You can share your story with us. What do you think about work requirements? What do you think about what might happen in the state of Wisconsin or some of those other 7 states where work requirements are pending? Or if you just want to send us an email, you can do all of that at healthwatchwisconsin.org.